InfoTrack. To get more information about our guests and topics, you can find InfoTrack online at TalkZone.com. Our show is produced by Syndication Networks in Chicago. Internet services courtesy of Pair.com. Thanks to this week's InfoTrack reporters, Roy Mackey and Taryn McCall. Our announcer is Charlie Van Dyke. InfoTrack's executive producer is Randy Meyer. Our engineer is Robert Saar. And I'm Chris Whitting. Till next week, thanks from all of us for tuning in to InfoTrack.
This is Power to the People on Power 104.3.
We are here again. It's Casey and Tantra on the Power Morning Show, and we are joined here by suicide prevention and really all facets of suicide prevention when it comes to Hawaii. So blessed to have these four people with us today. I do want to introduce Dan Yahata, who is president of the American Foundation for Suicide Prevention, the Hawaii chapter. Thank you so much for being here.
Hello, Dan. Hello.
All right, also to Nancy Deely, Suicide Prevention Coordinator of the Injury Prevention Branch. Welcome.
Thank you. I'm really happy to be here.
Thank you for being here. Larry Walter, Chairperson of the Hawaii Prevent Suicide Task Force, is here as well.
Thank you for the invitation.
Yes, and also we have an attempt survivor here with us today. We look forward to speaking with Melanie Gibson. Hi.
Thank you. It's an honor to be here.
Thank you for being here. All right, let's get started. So how are you all connected? Let's talk about that.
I think it starts with the state. We're kind of the hub of these different organizations, although Dan has just broken off recently. But I'm the coordinator, and so it's my job really to collaborate with the community and to help the community build prevention awareness. So some of the things we do is we have a task force. Larry's the chair of that. Okay. And it has over 150 members. And so they work on what we see as the priorities, and those priorities are trainings, public awareness, and policy development.
Okay.
Yeah. So this is part of our public awareness.
I see. Okay, great. So how did suicide prevention start in Hawaii?
It actually, you may have more of the background, Dan, but it actually started about 12 years ago. A mother who was a survivor named Pua came into the injury prevention office and wanted to know how come you don't have anything for suicide. What's wrong with you? You know, she had just lost her son.
Yeah.
And so at that point, the people there were like, wow, why don't we have anything going on for suicide? So they started putting together legislation, and the task force was actually born pretty much right then.
Yeah.
And the task force just came together to say, how can we get the word out on what's happening in suicide prevention? And you were there for that, Dan.
You remember the birth of this, Dan?
Yeah.
Give us the background.
Yeah, just an amazing group of people coming together. My own experience, I guess, with the peer education program at the time, the Department of Education teacher, a joint project with the Department of Health and Department of Education to produce a youth development program. So this was helping youth to learn about health issues and become advocates for health. And suicide prevention was one of those topics that we covered. And so from the peer education program and that sort of joint Department of Health, Department of Ed project, we were able to start some prevention and write some, it's a Gatekeeper Native Hawaiian manual that we started. Yeah. And so a growing number of folks got on board, and the group just kind of came together. And I think the Surgeon General probably back in 1999, 2000 area brought suicide prevention to the forefront, and really through the data drove a lot of people to want to make a difference. And so a wonderful group of people came together. Department of Health, we had representatives on the task force from the military, from the police department. I mean, Larry can talk more about who's involved now.
Yeah.
But it's just that whole grassroots wanting to do good things, spurred on by Pua Kaninau Santos, who's our spiritual leader. And
how many years ago was this?
Yeah.
So this is just recent.
Well, yeah. I want to say since we started with peer education, it's probably 20 years of experience in the field of suicide, and really the Surgeon General kind of kicking that off.
Right.
Heightened awareness and 36,000 deaths a year to suicide at that time, and so
Yeah,
it really became an issue, a public health issue for us.
yeah. So what is your part in this, Larry?
What I want to say is that in the ensuing years since the inception of the movement within the state, under the tutelage, the umbrella of the Department of Health and its prevention section, each of the islands now has a functioning suicide prevention task force. Those task forces are mandated to bring to each of the islands educational programs for awareness and prevention, intervention. There's a lot of community work done in involving folk who have been touched by suicide in one respect or another, whether they are an attempt survivor or whether they are survivor of suicide. And what that means is that in their circle of family or friendship or school classroom, when a death by suicide occurs, there is a ripple effect that impacts many, many lives. So what we're pleased with is the task forces on each of the islands able to interact with those folk in particular and general population on a more broad-based stroke so that people can become aware of the presence of suicide, its impact, and how we can, as a community, approach suicide as a community health problem and make our response being very positive across the.
Wonderful.
Can we, have you done a comparison as to where Hawaii ranks as far as, suicides are concerned compared to other states? And do we have a high rate?
I actually have the data on that from 2004 to 2013, and Hawaii ranks 34th nationally in its rate of suicide deaths, which is the 16th lowest rate. But then you need to look at that we are really a very small state.
Right. So per capita, that would, yeah.
And it's the single leading cause of fatal injuries in Hawaii over that time period, and it's kind of increasing. The trend is increasing there.
Wow.
And as far as youth goes, we're the 7th highest in suicide, 7th highest in making a plan, and 7th highest for attempting having a self-inflicted wound, going to the hospital for treatment.
Okay. I want to go into some facts about suicide so that we can further understand it more.
So, as I said, the most common cause of fatal injuries is suicide. And over that time period, 2009 to 2013, there were 878 deaths by suicide.
Okay.
And for youth during that period, there were 40. And with the youth, in addition to those who died by suicide, 5 times that number were hospitalized, and 140 per year were treated in emergency rooms. So it's really it's a huge problem, but its highest group is really our youth.
Okay.
Yeah.
So, which is who we're talking to.
That's another way to look at it is a person dies by suicide every 2 days in Hawaii.
Wow.
Why is it? What's causing the youth to want to attempt suicide? Suicide is a very complex issue. You can't really pinpoint. When someone says to me, Harry, what causes a person to die by suicide? We can't give them a clear answer because it's very, very complex. We have research that indicates that the person who are gripped by depression, other mental health problems are more at risk. But that doesn't mean that a person who is suffering from depression or other mental health condition is going to suicide, attempt or die by suicide. But these are keys for us. There are factors that put a person at risk that are behavioral or environmental, social. When we look at the whole package around a person, we're then able to indicate that a person may be at higher level of risk. That gives us some insight into that.
I think that's a good segue into Melanie's, because Melanie is an attempt survivor, so,
Do you ever, my question is, I know you can't pinpoint it, but when it comes to the youth, but do you ever look into even deeper as to like couples, teenagers having broken up?
Yes, relationship
problems
is the number one that we find.
Really? Okay.
Wow.
Yeah.
I'd like to welcome Melanie Gibson again right here. You are a temp survivor.
Yeah, 4 years ago.
First of all, what made you want to do it?
It wasn't just, that one time. It was my whole life I'd heard threats of suicide from a parent. And so it was almost commonplace to me, like it wasn't, if you're having a bad day, it wasn't, oh, how do I cope with it? I'll go take a bubble bath. It was, right. I'm going to go to the beach and kill myself. That was a normal, and it's still a normal in the household. And so for me, when times were really tough, that was, I'm not talking about like even just a bad day, like a really bad day. And at that point in my life, my husband had returned home from his fifth deployment. I had lost my sister to cancer, and my then teenager was completely out of control.
Okay.
And I just felt like my whole life was insignificant. Like there was nothing that I'd done right, that I could do right. And we had a huge family argument that night, and I had threatened suicide, much like my mom, so many times in my life. I had a couple of times tried to make a plan to end my life by suicide. I had written out letters to people at a couple of stages in my life, but I never did anything about it, but I cried wolf a lot. And when that night happened, and it had become too much, and my son had been in rehab for a short stint, and he was 17, and I felt like a failure. But when they sent him out of rehab, they sent him home with all these medications, and after the fight that night, and my son had left, my husband was in the garage, and I looked down at the sleeping pills, and I thought, why not? I've said it so many times, I'm not doing anything right in this world, and what's the point? And so I took the sleeping pills.
Wow.
What happened after that? I don't remember all of it. What I do remember is thinking, oh my God, what have I done? And I went out, my husband was still in the garage, and I walked through the house. And if you've ever taken a medication like that kind of the altering feeling you get where you feel a little bit floaty, I remember just like feeling that times 100. And I remember walking to the garage, and I told my husband I did it. I overdosed. He didn't believe me. And I walked back into the house, and in my mind, I just thought, this is it. And I kind of, in a little sting of vanity, prepared myself to die, to not look horrible. And then I heard my husband walk in the house. And I don't remember a lot between him walking in, but then I remember hearing a pacing house on the phone with 911, and I could hear the panic in his voice. And the next thing I remember, I was laying or vomiting, and I remember hearing the ambulance wheels. We have a tile floor, and the ambulance hit the tile. I being put on a gurney, being put into an ambulance, and the ambulance ride, or the EMT speaking to me and asking me, to please stay alert, to stay awake, keep talking to him. And I think one of the hardest things was when they brought me out of the ambulance into the emergency room. I remember when they wheeled me out of there, they said, as I came in through the doors, they said, we have an intentional overdose. And I just remember that was just, there was so much shame associated with that. Nobody in that lobby knew me, but to me it was embarrassing. And then we were sitting in the
the emergency room. They'd given me something to drink to act the medication that I had taken. And I remember I didn't want to look at my husband, and I've been married to him at that point 11 years. And I remember looking out of the corner of my eye, and he just looked so sad, you know. And I didn't want to make eye contact with him because I was just so ashamed. And that almost like from that day on, until I met my friend Carrie Bosworth, who coordinated the Darkness Walk here, from that night until meeting her and being able to open up about what I had done, I was just ashamed. I was so ashamed of what I had done. I couldn't say the word suicide out loud. I didn't make any friends. I isolated myself out of fear that anyone that I met might find out what my secret was, and I didn't want to know. I didn't want anyone to know. I didn't want anyone in my husband's command to ever find out what I had done, because I was afraid I would ruin his career with my own affairs and what I had done. And I met Carrie, and then she had posted on Facebook that she Dorothy Out of the Darkness, her stepson's honor, who had died by suicide. She actually put the word suicide on Facebook, and I thought, oh my God, you know, this one's brave. Like, I can't even say the word inside my own head. I can't say the word in the house with embarrassment. And she put it on Facebook. That friendship really, it changed my life, because it allowed me to share my story with somebody outside of the 6 people that had not, at that point, 4 years of my life, have hidden behind that. And it changed me mentally and physically. Who I was then, 3 years ago was not, or a year ago, was not who I am today. So that one meeting, that one has done a 180.
I just want to say that at that walk was the first time that I actually met Melanie, and she was talking in front of a couple of hundred people about her story. I think it's the first time, yeah, Melanie. So
Yes.
yeah, so she was reading, and people were all around, and then her mic went out, and just everybody came forward as one group and just surrounded her to hear her story. It was so moving. So
it was very powerful. Because when Mike died, I panicked. I'm like, looking around at everybody, like, what do I do? And they said, just keep going. And so, I kept going. I talked as loud as I could, and I did, my vantage, and I saw like this sea of people come at me, drawing closer. It was a very powerful. That day is the most impactful day of my adult life. Is me sharing my publicly. The people that came up that I had from sharing that story was, it was very powerful. Because every time I share my story, I hope that I can help somebody else, but I know every time I share my story, I heal more every time.
So that Out of the Darkness walk is part of the activities that the American Foundation for Suicide Prevention provides.
Okay.
Opportunities for folks to gather, for us to raise awareness, to raise funding that then goes into programs and services. And really our goal is to activate survivor communities and those that have been affected by suicide to come forward. And so, Melanie, thank you so much for participating.
Yeah, I have to say, knowing that you were going to come speak with us today, I was already floored, that you were going to share your experience with us, but now even more so knowing that you had issues even admitting it to yourself before you came out to others, that takes it to a whole nother level. Where are you at today?
Today, I'm very proud of where I am today. Since then, even coming to do something like this, to be asked to speak anywhere, to me is a great honor. I was asked to speak next week at Oakville Barracks, where they do their, they have their normal, where they do their safe days, and they talk about suicide. And I guess the commander had found out that, we don't want to see another PowerPoint presentation. We want like a real person to share their story. And so I'll be going up there on Wednesday to speak to them, to up there about suicide awareness, suicide prevention, share my story. You know, I don't ever come at this with statistics or facts.
Yeah.
I don't. But where I am is like, it's a journey for me. Every day is, I'm a grandma.
Yay!
So, you know, things like that is like, it's so exciting to know.
Yeah.
And, I write a blog now. That was one of the things I started to do to really help my feel. And,
Where do you write it? Tell people where,
my blog address is invisiblethreadsconnectus.com.
Okay.
When I looked through this, when I started to speak out, is when I first shared my story on Facebook, it was in part to share my story, to be open about it, but also to fundraise for the Out of the Darkness walk this past year. And the outpouring of love that I got was not, but the people that responded back said, "Oh my gosh, you know, I lost an uncle to suicide, or I've contemplated suicide. You know, I lost, you know, people. We are all connected by suicide, thoughts of suicide, loss." And so that's why I chose the name Invisible Threads Connect Us. And in that, I feel like I heal every time I share something in my blog about where I am, but I love.
My question is, you know, you said prior to attempting, you said you had cried wolf. You had said something, you had given messages that you could possibly do this?
Well, what I had done was quite like my mom does. It is to say, when I'm having a bad day, or if I'm very upset, angry, my go-to would always be, I'm going to kill myself. Because that's what I learned. And that's not an excuse. That
Right.
is just, you know, they said children, what they live. And
Right.
that is what I lived every day. So what I have, you know, I have sat in the bathroom crying with a gun in. I have a razor blade, but I was too afraid to do those things because they were so, I mean, for a better choice of words, they were just ugly.
Is that something that we should take seriously every time someone says that? Is that one of the things that we need to look out for?
Yes.
Yeah, we encourage people to take every mention or threat of suicide very seriously. One of the things that we encourage people who are concerned to do is to use the word suicide, to reflect back to a person who shares such thoughts, simply asking a very profound question, but a very meaningful question. Are you thinking of suicide? That usually opens up a dialogue, conversation, and you will know pretty quickly whether or not the person who might be contemplating suicide is indeed having the means to do it, or if, as Melanie says, it might be just a cry or a wolf statement. However, even that is serious enough, and we encourage folk and we train folk in the work that we do across the state. We train folk who make responses appropriately and bring that person who is experiencing the thoughts of suicide into a safe situation through a mental health professional, a caregiver, this type of thing. No, we take all expressions very, very seriously.
You know, here in Hawaii, we have a crisis line. It's called the Access Line, and it's for people to call who are in crisis, and we can send out crisis management people to where they are, or call the police, or sometimes it's just like Melanie, they just like want to, but they're not. You know, it's kind of the thinking about stage. So I just want to give you a few numbers because they're really important. Right. So the Access Line on Oahu is 832-3100. And on the neighbor islands, it's 1-800-753-6879. I'm going to give you two more, and I hope that, you'll write some of these down. But the national hotline is linked into our Access Line, and it is, they have thousands and thousands of calls per year, but their number is 1-800-273-8255. And if you're associated with the military, you just do *1 and you're hooked up with somebody from the military. And finally, here in Hawaii, there's a mental health Hawaii organization, and they have all kinds of resources, and they can direct people or help people with whatever's going on. And their phone number is 521-1846.
Nancy Dealey, can I ask you, what is your connection and what's your story with Suicide Prevention Coordinator? Why you chose to do this?
Okay, I don't. I actually have worked in HIV/AIDS for many years.
Okay.
And I was the testing coordinator for that.
Okay.
So about a year ago, we started losing funding for HIV as our numbers went down. And so my friend was in my position, and she was retiring. So she said, "Come on over." And so I applied for the job. And
Wonderful.
And I became the suicide prevention coordinator. And I have to say, when I walked in the door, I had no idea the impact or anything really about suicide and its effects on the community and the individual. So over the past year and 3 months, I've learned so much, and I've met so many great people. And Melanie, oh my God, she's so courageous. And I've learned so much from her.
So you're an Earth Angel. You like to help people.
Yeah.
You're here to help people.
I'm here to help.
That's wonderful. Let's go over with you, Dan, about the event that we spoke about with Melanie, the Out of Darkness Walk.
Yeah, there's actually an Out of Darkness Walk coming up in September, and so it's that event that Melanie talked about is coming up again in September, on September 12th.
Okay.
There's a website up already that you can kind of go for more information at the Oahu Out of the Dark at gmail.com. You can also hit us up at the AFSP Hawaii Facebook for more information. And
who's invited to this? Who can come?
Okay, so it's just everyone. And we
Everyone,
want to try to get as many people as we can. It's at Ala Moana Park.
Okay.
So it is to raise awareness. It is to raise funding, important funding that will go to programs and services that help us to reach out, to provide hope, help, and healing to those that have been affected by suicide.
Right.
But it's also our connection with the national organization to promote research and advocacy through legislation. We recognized the 2 organizations this past Friday at the Party for Prevention. It's a silent auction event where we raise money as well, but we also recognize the Injury Prevention and Control program with Nancy Dealey and her entire team for their work of the past 20 years in reducing the incidence of suicide and suicide attempts in Hawaii. And we also recognize Representative John Mizuno, who's also been a strong partner for us in the legislature that allowed us to advocate for funding that comes to the Injury Prevention and Control program that provides opportunities for programs and services to be presented across the community. So we urge everybody, come on out. So keep it on your calendars.
Can you walk us through this event? What we can expect from it? Please, Larry, jump in.
Oh,
Yeah, Melanie was there. So
well, I mean,
can tell you a bit
for me,
more.
I was there for the first one, and I actually joined that committee because my friend Carrie, she was starting it, and I told my husband, let's just do this. I had no idea that it was going to be as big as it was, and so we really only had a few short months the first year to put it together. But you come in, there's a few different tents. The one tent that's very powerful for me is the bead tent, and you go there and you wear beads that represent certain colors, or whether you've lost a child, if you just support the cause, if you've lost someone in the military. That was the first year was a big thing for me, because at that time there was only one designation for someone like me, which is the green beads. If you personally struggle with mental depression, illness, that sort of thing. And so for me to put those green beads on that day was really my first public, proclamation of, hey, I am someone that struggles with mental depression. I actually wear this green necklace every day. I never take it off. And it is my reminder that, that I put those beads on that day, and I was strong enough to admit that I personally struggle with mental depression. But you'll do that, then they'll have an opening ceremony, and then you get to walk with everybody else, which is, it's a good time. You walk, you interact with other people. It's beautiful. It's, Magic Island. and they have a closing ceremony. And they have, last year we had really, Celine had done a tent that you could go in and take this pot with some dirt and plant some seeds and take that home with you so you could see something grow out of that day. It was really a beautiful thing.
Oh.
So we're getting ready to PCS to move back to the mainland pretty soon, and I found some of those seeds, and it was just such a beautiful reminder of that day. So
Right.
it's a great event.
You know, can I bring something up really quick? Because you said that your military family.
Yes.
That's a huge suicide issue in the military.
Yes.
I'm aware of this. Do these? This is just gonna be basic numbers and trends question. Do we count that when we're talking those suicides about Hawaii? Numbers and suicide. Do we take into account the military here?
To some degree, we do.
Okay.
Because we get our findings from death reports.
Okay.
And from the morgue, and the soldiers sometimes are in Tripler Hospital, and so we don't necessarily get reports from them on how many there are. So just recently we've started really coordinating with the military.
That's great.
And sharing a lot of data. I just recently got a whole bunch of stuff on the VA.
Yeah.
So our task forces are working together, and as we do, they're finding new ways to get the data to us. So it's pretty significant. They have a higher rate than we do for sure.
Right.
To just add to that, I think that the World Health Organization estimates 800,000 deaths a year.
Wow.
And that is
That's alarming.
that's one death every 40 seconds.
One of the things that is important, I think, for people to understand is that the work of suicide prevention is indeed open to everyone. It's available. It's free.
Yeah.
And that we are very thankful to the state for making a lot of our training opportunities, public awareness opportunities available so that people can attend them free. I think what's important for people to know is that if they are experiencing thoughts of suicide, or they know of someone who is experiencing thoughts of suicide, now, the immediate moment is the time to reach out for help. And here on Oahu, there are community agencies that are available to do that. You can always, of course, call Nancy's office. And on any of the neighbor islands, there are the task forces who are mandated, they're there to provide community education, awareness, even intervention. So I think the bottom line is that if a person is experiencing thoughts of suicide, that is the very moment to seek the help. It's there.
I wanted to go back to the. Go ahead. I wanted to go back to the 800,000 estimated suicides, and I think you need to also think about all the ones that are unreported, and all the ones that are attributed maybe to car accidents,
Right.
or some other reason that somebody would be out there taking their life. So when we say that that's the estimate, I think that you really need to also process that. How many others,
You don't know if they're driving and crashing their car and we don't know. Yeah, we don't know.
And just to put that in perspective too, it's if a plane goes down with 300 people,
Right,
and it went down every day.
right.
Well, that just happened, right? Didn't that just happen?
Yes, it
Yeah.
Yeah, but it would be like that plane crash
Every day. Oh,
Wow. Yeah, it's very tragic, and that's why we are so seriously committed to bringing awareness to the public that where help is needed, help is available, and there is hope.
Larry, you work with law enforcement here?
No, I do not.
Okay. Just wondering.
Well, in terms of working with law enforcement, we provide training to law enforcement officers.
So you provide training. So, one of the things I'm always curious about is when they have to respond, when the local law enforcement official have to respond to an attempted suicide, and what you need to say to people who are on the verge of attempting the suicide. Are any steps that you can make? Someone who they may be faced with a situation.
What do you do? Police officers in their daily routine are in the forefront. They are there, and very often they are the first on the scene of a report of an attempt process. That's one of the reasons that we really reach out to law enforcement agencies to bring them training. We provide a number of different training opportunities for them, and in that training, the officers receive the skills to do an intervention, to be able to acknowledge a person's plight, to acknowledge the desperation of their present feeling, and then to work with that person to bring them to a safer place. We have found, and research and statistics have proven, that an intervention in a suicide attempt is most often successful, and that is very encouraging to us. Of course, there are those who will die by suicide no matter what, but I do want to emphasize that research has proven that when an intervention occurs, the risk of death drops dramatically. So we try to train the officers, give them the skills for that moment. Dan, you were going to say something?
Yeah, just in general, I think when you think about youth and their situation, it's really heightening your awareness of the changes.
Yeah.
We all have.
What do you do as a friend? Like I have a friend who used to tell me this, and I'm thinking, okay, what am I going to do? I have a friend who would say to me, "I'm done with Earth. I'm done with this place." And I don't know if she's just saying that. Is it something that I need to be alarmed about? I mean, and what do I do in that situation? Do I talk to her and try to, just feed her away from that thought?
One of the things that we do in our training is, if you let me role play on you just for a moment. So here you are, a friend of mine who is expressing thoughts that you want to be off the earth, that you feel is your life is no longer a purpose of value. What our training would help a person to do is to respond to you in this way. We would say to you, sometimes when people are feeling like you are, that you are not feeling good about life, that you're feeling your life no longer has any purpose, then that you've lost your sense of meaning, sometimes those people are thinking about suicide. Are you thinking about suicide? And then we'd wait for the answer. And if the person says to us, yes, I am, then we know which way to go in terms of getting them to what we call a safe place. If you were to say to me, oh no, I'm just blowing off steam, my response has always been in those situations, but you're using some terms and some thoughts that cause me some concern. Let's find a way for you to share your thoughts with someone who can give you some good feedback, good nurturing. So you see, the whole goal is to get a person into a safe place.
Right.
But we take every reflection of a thought of suicide seriously, because if we don't, we could miss it. We could dismiss it. We could avoid it, and suddenly we discover that our dear friend has died by suicide. I would rather have a friend very angry with me saying, keep your nose out of my business. I'd rather have an angry friend than a dead friend.
Wow. Okay.
I want to say something about the youth, and I don't think the youth necessarily would respond to that kind of conversation. And so, although they need training, they kind of frame it in their own way. We had some PSAs a couple of years back, and they were field tested with adolescents, and it was real local delivery, and we think those were quite effective. And we're also having a conference next Friday in Kona.
Okay.
And part of that is a youth track, and there's going to be 80 kids from high schools all over the state, and they're going to have leadership training and know how to talk to other kids and know what the responses are. And it's just been the people working on it have been terrific, and so I think out of that, we think that how youth speak to each other will grow.
Right.
With how, things have changed in the world, and especially with youths, and there's so much technology and media, and things are just, over communicated in a way. Obviously the trends of suicide have changed, and you said that the number is actually rising, Nancy, right now. One could say, could it be normal for people to have thoughts of suicide? I just think, how it's, the end of the world is so, I guess, used now, and it's almost desensitized. That's the word I'm looking for. How do we differentiate, and do we just not differentiate and treat it serious?
Yeah, I think one of the things about youth is it's going to come in cycles as well. It's going to kind of have some peaks and valleys and kind of move and be a sort of a moving target. We want to err in the side of caution, and we want them to refer, don't hold those things. Even if the friend says, promise you won't tell anyone, it really is that situation where Larry described as if they were to complete suicide, how would you feel?
Right,
you have information. So we're really encouraging youth that see changes and are more sensitive to maybe the breakup, as you mentioned earlier, Casey. It happens that we're more hypersensitive. Facebook, social media, there's
I see like posts from teenagers, FML. I mean, I don't want to spell that out, but they say FML, my life. By the way, F my life. But I see that as a common thing that kids say these days.
Yeah,
and whether to take that seriously or not, you really have to, I guess, look deeper into their posts.
Or how do you go about that?
Well, one of I'm not sure I'm addressing that exactly. But one of the things, we've been trying to develop is a texting helpline, because that's how kids communicate now.
Right.
I just came back from the mainland, and there's lots of states and helplines that are bringing texting in. We're at the very beginning stages of that. We're really kind of behind, but that's one of our goals.
That's great, though. That's wonderful. Yeah.
Yeah. There's Dan Reidenberg is one of the experts that we've been working with in Hawaii. He's the director of SAVE. Save.org is another wonderful website that you can go to for information. And through his work, Google and Facebook are looking at how can they respond to posts that are happening.
That's good.
You do Siri and you put something into Siri. He's leading the charge on how the response from Siri even happens when you ask a question like that. So there's a lot going on to address the social media aspect of depression, suicide attempts, and just trying to be more proactive and be preventive in nature.
Yeah. Daniel Hata, president of the American Foundation for Suicide Prevention Hawaii chapter, is with us today. Power to the People with Casey and Tantra on the Power Morning Show. Also here with Nancy Dealey, suicide prevention coordinator of the Injury Prevention Branch. Larry Walter is with us as well, chairperson of the Hawaii Suicide Task Force, and Melanie Gibson, attempt survivor, is with us today. Thank you again all for being here. I'm sure that we need help. We need money to keep this going. Let's go over your website information, and are you looking for volunteers to help?
Was that directed at me? Yeah.
Sure. Jump right in.
Yeah, definitely. That's one of our goals, really, is to activate those that have been touched by suicide, affected by suicide, those that are thinking about suicide. How can we prevent? How can we get funding so that we can provide programs? We have a walk coming up, so September 12th is the way to get involved in that walk. Come out and become a part of the suicide prevention efforts in Hawaii, as well as you can hit us up on Facebook again, and AFSP Hawaii on Facebook, and Nancy has some other information.
Right.
One of the things that we do is we do trainings around the state, and the Department of Health contracts with the Department of Psychiatry over at John Burns Medical School. And so part of these trainings is that we locate gatekeepers. These are just people out in the community, and they go through trainings. And there's a 3-hour training called Safe Talk and a 2-day called Assist. And they actually serve as volunteers for all of us, because they get all the information and then they form their own groups, and it's kind of a web that spreads out. So that's, I think, our biggest source of volunteers.
So do you look for gatekeepers?
We advertise. We advertise for it. Sometimes somebody knows somebody.
Okay.
We'll schedule something and then people will respond. And right now, for the first time, we're actually coordinating with the military.
Perfect.
So we're kind of expanding our trainings, and they're going to be part of ours, and we're going to leverage their resources. So it's fabulous.
That's great.
Yeah, and just to add to that, the Out of the Darkness Walk, there's also the outreach to survivors of suicide, loss, and there are programs that we have that bring families together to be able to talk and help and healing is what we're hoping at these events and activities to invite the public and the community out. So
Right.
go to our website, hit us up on Facebook, get that information so you can keep it handy, and encourage everyone to come out and participate with us.
Register your team, fundraise.
And tell us more about the Out of
Yeah.
the Darkness Walk. I mean, what people can expect and how they can be a part of it. You can talk about it again and give us your website and your blog address that you want to share. Melanie Gibson.
Yeah, Melanie Gibson, a survivor. My blog address is invisiblethreadsconnectus.com. And I really just share my own personal struggles. Now I share more of my victories, because even though I do still have, some issues, some struggles, I think it may be something that I will deal with for the rest of my life, but I feel like I'm equipped to deal with it better. I feel like I had written a blog last year, Melanie 2.0, because I feel like I'm a better version of who I was.
Right.
So, but when you come to the Out of the Darkness walks, you'll have the opportunity to go to the bead tent, which, as I said, is a very impactful part. You get to wear beads that represent certain things, whether it's your own struggle or someone that you've lost, someone in the military that you've lost. You can have every color bead on if you want, if that suits you. And they'll have an opening ceremony. You'll get to walk around Magic Island, and then you come back, have a closing ceremony. I don't know what all they're going to do. You can go onto the AFSP website. You find your local walk, which you would search for the Honolulu Walk at Ala Moana Beach Park. And then you can start a team. You can join a team if you already know someone that has one started there. Last year, I started my own. I named it Team Roar, because that's Katy Perry's song Roar really spoke to me. And so I named my Team Roar last year, and it was myself, my husband, and my son, and we fundraise. And the website is very user friendly. You go set up your fundraising page. You can share it on Facebook. You can share it on Twitter, wherever you want. And I even had links on my blog at that time to where people could go and exactly.
Yeah.
And so it allows. It's a very easy way to be able to put it out there and ask people to fundraise. And for me, because I have a personal story attached to why I'm there.
Yeah.
It was very easy and very organic for me to do the fundraising.
That's great.
But I do want to say, one of the things that I have really learned is, although I have used the term cry wolf, and that is something that I heard from the training, and I recently did assist, I look at it now. Anyone that reaches out to me, and it happens quite frequently now because so many people within my circle know my story, when someone, even if it seems maybe they're just having a bad day and just feel like they're ineffective and they just need somebody, if they even mention something that remotely concerns me, I take it very seriously. So I don't see it as you're just going to cry wolf, because anyone, I don't think that I went about my suicide attempt in the normal format, if you will, for what I learned like in assist training, so how they had you do the role playing. That's not how I went about it. I hid behind so much for so long and pretended like I had a perfect life, and it was falling apart on the inside. I had my little trifecta of my husband's deployments and my sister dying, and today is the 5th year anniversary of my sister's death.
Oh, wow.
And so, that and my son, and it was like, I, went around with a smile on my face, like, I had Tiger by the tail and it was all okay. And it wasn't. And it's okay to say that right now it isn't okay.
You said you hid it for so long. Mm-hmm. Did people ever ask you?
No. Anything
wrong? What's going on with you?
No.
Nothing.
Never. Because I wouldn't let anybody know.
You were a good actress.
I was. I could probably get
Question for you, Larry.
Yeah.
What about people who don't talk about it? What other signs can you look at?
Thank you. There are a number of signs that will trigger our thoughts that perhaps a person is at risk. Changes in behavior or mood. Changes in performance in school or work. Drastic changes in social behavior. Sometimes it's matter of drastic changes in food. For instance, in terms of behavior, if there's a person who always seems very extreme, outgoing and happy and
Right.
just bouncing, they suddenly become very, very quiet. And you wonder, you can say to them, hey, I've noticed a change. What's going on? Or in the reverse, someone who never says a word, who's just very, very quiet, and suddenly they're bouncing off the wall. You can say, wow, I've seen these changes. Because sometimes these, what we would think subtle changes, could be indicative of a person at risk. So in the trainings that are provided, we give people some insight as to what to see in a person's behavior. We invite them to look at a person that they feel might be at risk in terms of what they see, feel, sense, and learn. Good old-fashioned gut. And you take all that together, and if you find that you're feeling, gee, my friend may be at risk, it is very appropriate to inquire, to say, are you at risk?
And I'll just add to that, it may not be the one thing that changes, but a series of things that
Yes,
you might
yes,
sense that are
yeah.
changing.
Yeah.
And for youth, you're going to be the best resource for us. So if you sense a change in a friend of yours, please do refer.
Right.
Teachers and counselors, the same thing. I think
Yeah.
if you're writing in themes of darkness and there are changes that you can sense in your students, then that's a referral. That's trying to get people to help and encourage help-seeking behaviors. Is really about reaching out and hitting the hotline.
One thing, Marcus, I had a friend who always wore wristband. Later on, I found out that he had marks on his wrist. Do you also train folks to look at?
Yes,
marks like that?
cutting is indicative of a child struggling. Cutters can indeed move into a suicide risk situation. So that is something that we would look for. Another thing, just following up on what Dan said and what you said about young people, it is a fact that young people talk to young people before they'll talk to an adult.
Right.
They share what's going on in their lives with their peer group. And our hope is to encourage younger teens and young adults who find themselves being on the receiving end of a person's cry for help to share that with a responsible adult, to help them get the help. But here's young folk, talk to young folk first. And that is why we are directing a lot of our education, awareness, and intervention programs at the 18 to 24 age group. Even actually, I have to be honest with you, the experience of suicide is early in teens as well.
How do we help someone who is going to attempt suicide or who is having suicidal thoughts? What is the process that you take them through?
The process would be, first of all, the intervention, the conversation that asks the question, are you thinking about suicide?
Okay.
Or that dealing with it on that level, because we encourage people to not say to someone, are you thinking about hurting yourself?
Right.
A person can hurt themselves and never contemplates death by suicide. So we use the word suicide because that has one connotation. Then in terms of the help, there is a network of support in each of our communities across the state that can bring immediate help. Nancy mentioned the crisis outreach operators, and they come right to the scene. And we're very pleased that in the state we have about a 45-minute average response time. That's pretty good.
Yeah.
So the person with the thoughts of suicide can then be brought to a mental health caregiver or even to a hospital emergency room, someplace where there can be a level of care to significantly reduce the risk for suicide. And then what we found most typically is that a person is not hospitalized. They're not into a facility. They're not admitted. Counseling is done outpatient-wise. Oftentimes it is done with someone known to the family. It could be a family physician. It could be a counselor. It could be a community of faith leader, a clergy. All of these things are available, and all of them are very, very helpful. So, long answer to your question is, there is help out there.
Okay.
There is help out there. If you were to fall down and break your leg on the middle of the road this morning, there would be help for you.
Right.
If your life falls apart, there is going to be help for you too.
Yes.
And Melanie mentioned the idea of shame. We try to break the stigma of shame.
Yes.
We talk about breaking the silence. And Dan is talking about Hope, Health, Hope, Help, and Healing. These are all part of it.
Dan,
Help is there.
There's
for
no
everyone.
need to be ashamed.
No need, no shame. There is no
look
shame.
at the beautiful things that have come out of it with Melanie, right?
Oh,
I mean,
indeed.
you probably healed and helped so many people that it's just trickling. You say there's a trickle effect when somebody commits suicide, in the negative realm. There's a trickle effect when you share the story in the positive, which is probably
Yeah, when I did the walk the first year and I was on the committee both years, not this year because like I said, we were moving, but that first year I sat around with a table of other committee members and not one of them knew my story. They had all lost someone to suicide, and that was a really hard couple months for me. We didn't have much prep time, probably thank goodness, because it would have been like an awful 6 or 9 months. It was only about 2 months. But I remember looking at all these people and I think, they lost somebody. And I had so much like survivor guilt for sitting there next to my husband who could have been one of those people.
oh yeah.
And so I told Carrie, I said, that's it. I'm done. After this walk, I'm done. I cannot do it again. And then, as it comes around, then I said, okay, I'll do the walk. I'll do it. But when I was that first year, when I was getting ready to go to the dinner that night, which I didn't want to go to the committee dinner, I thought, I don't even want to see these people anymore. I'm so done with you. And I didn't have a car because ours was in the shop. And my husband was working. And so Melissa, one of the other committee members, she picked me up. And I didn't want to go, but she insisted. And so she sat across from me for 2 months and had no idea. She had lost her brother Ian to suicide. And in the car, it just kind of spilled out. And I shared my story with her. And she said to me, we're sitting in the parking lot. And she said, you have no idea by opening up how many lives you can affect. And I thought to myself, no way. There's no way I can't tell everybody what I've done. And but what she said to me, just like it stayed in my mind, and I always thought about it. And then as I got a little bit more brave and I started to write my blog, InvisibleThreadsConnectUs.com, then I started to open up a little bit more, and I was like, okay, maybe I can share this. And now I could not imagine me today not being this person being brave enough to share my story, because I know firsthand, because people have reached out to me, that my story has touched and affected their lives in some way.
I'm changed today.
Yeah.
I'm definitely changed. I just want to wrap things up. We have about just a couple more minutes left. So I just want to give you all such a warm welcome for being here, and a warm thank you for sharing this with us today. Before we leave, let's please go over what events are coming up again, so we can try to get more help for you, so we can help more people. Dan, if you want to.
So, mahalo, Tantra. There is the walk that's coming up on September 12th at Ala Moana Park, and the AFSP website that you can go to be able to register and participate. And I was just going to add to Melanie's stories that families come to walk in memory of their loved ones. We have service providers that come that are part of the warriors that go to battle every day. We have people that are from the University of Hawaii's School of Psychiatry that are on hand as well to provide support. We have agency partners and tents from Queen Liliuokalani Children's Center is a tremendous supporter of our efforts. And so communities coming together and spreading the aloha. I think that's the whole prevention effort is really, if we just cared for each other, if we were a little bit more sensitive to the needs of others, and if we are more tuned into our friends and our families, that's where your sphere of influence is going to start. And then when you're ready, as Melanie experienced, I think as it gets wider and wider, your ability to then come and affect this effort and the entire state of Hawaii. So start with yourselves. Go with your family and friends, and then think about the impact that you might have in the community.
One of the things that's happening on a statewide basis is that next week, on April 30th, next Thursday, the State of Hawaii Suicide Prevention Annual Conference is taking place on the Big Island at the Waikoloa Marriott. It's going to be a gathering where we present a nationally known keynote speaker, and then a series, I think, very valuable workshops to engage people in education and discussion about the various facets of suicide. We'll be doing a significant piece on working with the media in terms of reporting and sharing information in a way that we call with safe messaging. There are certain ways that are very helpful and healthy in relating suicide, and there are ways that are very, very detrimental. So that'll be a part of our conference.
Yeah, I want to. Can I just ask you briefly about that, because I've come across that the way the media reports suicides and what's detrimental. What they say is that what is it? What are things that we cannot use and we should be using when we report suicide?
Thank you for asking, and I know that Nancy has some material for you that she'll leave here at the station.
Right.
What? Yeah. What?
Right.
Thank you. Yes, thank you.
In general, what we would say, and particularly in terms of the media, is that the response in the media, print or voice or broadcast TV, is that we encourage people to not sensationalize a death by suicide.
Mm.
We have seen recently in some celebrity deaths by suicide that it just becomes a media event, and we encourage that not to happen, because if a person in their life is struggling with trying to feel important and doing something of a grand nature before they die, they might make their death that grand event. So aggrandizing a death by suicide is very detrimental.
So let me give you an example. Whitney Houston.
Yes.
What?
Robin
Williams. What did you hear things or see things that you wish the media didn't do?
Yes.
Give me an example.
Dan, you want to respond to that?
Yeah, I think it's just the contagion effect. We have to be really careful and sensitive. So you may not see things that are reported in the news unless it happens in a public place or it's a personality of some kind.
Okay.
And so in that way, we want to try to minimize the contagion effect and to sensationalize that event.
Okay.
And so some of the media outlets that may I want to say a lot of good things came out of that Robin Williams passing.
Right.
Yes.
That there was a raised awareness as well. And if done correctly and properly, I think folks actually seek help.
Right.
Because they're feeling similarly.
Yeah.
But at the same time, there's that really
I remember
sensitive.
when Robin Williams' death came out, the way we approached it was because we were baffled as to a comedian, a funny guy, you wouldn't think. So we had to try to get into the deeper root of the problem. What could he have possibly said, or
Yes.
to people or to friends? It's
To remember the good times,
Right.
because it's already been done. I remember that was something that we wanted to stress, but also to remember to say that this is not the way.
This is not. Yes.
Thank you for that. Yes.
And yes.
When you talk
Yeah.
about Robin Williams, I think one of the things that came out of that is much more an awareness of mental health relationship
Yes.
to deaths by suicide. And if nothing else, I think the awareness of mental health, that you can get help,
Right.
seek the help that you need,
Right.
and that was a terrific message, I think, that came out of that.
Again, I want to thank you all for being here. And Nancy, before we go, can we please, if you are out there and you are having a hard time, we have some phone numbers for you. Let's run down all of those.
Okay, so on the state level, we have what's called Access Line, and it's a crisis line that you can call into 24/7. And the number here on Oahu is 832-3100. And if you're on a neighbor island, it's 1-800-753-6879. We also have a national health line that operates in all 50 states, and they also are connected into our Access crisis line. So if you can't get through to Access, you can call the national, and they will route you around. So their number is 1-800-273-8255. And if you're a member of the military, after you dial that number, just press 1 and you'll be connected to somebody in the military for support. And finally, we have Mental Health America Hawaii, and you can call them at 521-1846 to resources and help from, I think it's from 8 to 5 every day.
Thank you all very much for being here. Thank you for what you do.
Thank you.
Yeah, we're going out with our Katy Perry. This has been another Power Power to the People with Casey and Tantra on Power 104.3.
Agreed politely. I guess that